So we can kind of go into the actual applications and how I use them in OT learning right now. I think it is very much aiding all my students. One thing that I have found since the Splinting Pro app has come out is, compared to the last 2 cohorts that I've taught this course, they are much further ahead earlier on comparative to the previous 2 cohorts. So this cohort, and it is truly something that I have been amazed at. So now when they come into lab, the last 2 years I would actually have to demonstrate how to fabricate the splint or the orthosis, and that would take up 20-30 minutes, depending on what it is, and that would waste a good portion of the lab. Now I give them the video, and they're able to just go ahead right away and get started. And I've actually found that they're well ahead of the previous 2 cohorts. So that's been amazing to actually see.
That's cool.
And all of them have said, all of my students who I've mentioned that to, they've all attributed it to the videos.
That's fantastic.
Okay, so we're going to start with the range of motion and manual muscle testing, and just kind of go through how I use it. I mean, this is going to be pretty straightforward, but I use the range of motion and manual muscle testing in actually 2 of my courses. One is the application of kinesiology to OT, and then the other course is we have a hand therapy, orthotics, and positioning type course. So it's basically hand therapy and splinting. But the nice thing about this is we can start with the palpation. So I'm just going to go through the elbow because that's a simple one to go through. But if you go through palpation, you can go through bony landmarks or soft tissue, and it's really able to kind of pull through different landmarks that are origins and insertions to various muscles that we speak about. And in my hand therapy course, we can use the palpation to actually start looking at dysfunction, right? So if we know where these structures originate as well as insert, we can go through and determine what kind of differentially diagnose based on the palpation. So I think that's one very simple, easy application. And then obviously we have the range of motion and manual muscle testing. So if you go through here, we can figure out end feel. We can go through and have flexion, extension, pronation, supination. And I love the videos that actually I love that they have the dots, like where the fulcrum, where the moving arm and the stationary arm sit, because it's a very quick visual. So even if students are not able to, here, let me pull this up a little bit better. Even if they don't want to watch the actual video, they can see those points on the upper extremity where the goniometer should sit. Okay. It also has the patient position, what's stabilized, what's the testing motion, normal end feel, and then your goniometer landmark. So it's excellent. And then also the normal range of motion. I think that's one thing that students always kind of have questions, because if you look at AMA versus the Orthopedic Association, they have 2 different varying measurements, and you can kind of see how they differ. We generally go off of the Orthopedic Association. That way we can kind of maintain maintain that consistency throughout our course. So I generally just say, okay, go off of the AAOS for range of motion. And then same with the range of motion, you also have the manual muscle testing right there at your availability. And I love that it goes into, when you look at manual muscle testing, it breaks it down by grades and alternative grades. But it's in-depth, but it's also very simple and concise, where students can figure out what they're actually doing without having to navigate too much throughout the application. I think in this generation, and maybe this is generalizing, but in this generation, everything, it needs to be very quick, easy to use. Otherwise, it's going to be that abandonment. So again, it's concise, it's easy to kind of flow through, and students have loved it so far. I've used it with one cohort for kinesiology, and I will be using it again this summer starting in July with a new cohort. And so it's going to be something that's required for just kind of like a textbook. And I've actually, for kinesiology, I don't use textbooks at all now. I only solely use the PhysioU app, and then an anatomy textbook that we use as far as just online content.
And I would just add in as well, our faculty, most of these apps have been built by faculty who really were trying to figure out a better way to, one, reduce costs for the students, of which I still use textbooks. So we're not getting rid of textbooks. I only use textbooks that really serve a purpose well. And the ones that don't serve a purpose well, we've been cutting them because the cost is just so overwhelming for students. And then there's the effectiveness. The other thing I would say, Samia, that you were mentioning about the different positions related to manual muscle testing or range of motion assessment. So I think that would be quite a useful conversation to have. We could always have it offline another time when we can actually chat. But there is a challenge at trying to meet the need of every single textbook because they're all kind of different. So I think within the body of the text, there can be alternate positions. That's one way to actually choose to be able to allow for the faculty to then say, hey, by the way, if this needs to be done in sitting, the landmarks stay the same. The stationary arm and moving arm stay the same. Sometimes these are done in sitting when the patients can't lay down. So I think there is a little bit of that flex where if you think about from a learning perspective, too many options. If every time you went to range of motion of one particular joint and there was 3 positions that they would have to learn, it can be overwhelming for the learner. So being able to say, this is the standard position, you can modify the position based on the patient's need. Yeah, exactly. The students always want one way. And I think what we should do then is to create flexible learners who can apply the general principle and then be able to flex based on the patient's needs, which is really, we're preparing them for real life.
Dr. Wong, I got a comment if I jump in here, Dr. Sims. A great example would be, giving the students the app and the assignment, review the elbow range of motion before you get to class or whatever. And so they'll know where the axis and the bony landmarks are for the stationary and movement arm. Now, what happens if it's a below elbow amputee and you lose your styloid process? Well, that's what you teach in the lab. Well, how do you modify it then? So that one way, what are you going to do when there's an absence of the terminal aspect of the limb? So that's where you'd go over that in class. Say, well, then you're taught to think, not just memorize. And so that's where that one way. I'm sorry, students, you're going to learn the basics. You know how to drive a car, and whether it's a stick shift or an automatic or a clutch or a standard, you're going to still know how to do that. And that's where I think a way to start out with is safe ground, safe land for the students. But you got to be ready to see there can be variations that you're going to need to be able to integrate and think through if that happens to come into your clinic, into your treatment booth when you walk in. So kind of an example.
Yeah, I think also the amazing thing, and just going along with what both of you said, is the nice thing is students can prepare for lab, and so then once we get to lab, they should be prepped already. They had those videos. They lose some of that anxiety that they had to actually do these techniques, and it actually opens up a little extra time. And I found this in my kinesiology courses. It opens up a little bit extra time to say, well, what happens if this person has these precautions and they can't be supine? How can you go about? And it opens up that availability to kind of critically analyze these tests. But in essence, what you need to do is teach the basics of this is how generally it's supposed to be, but it's not always ideal in a clinical setting, right? So we have to teach it the right way first before we can teach the way to kind of make some variations, right? Just kind of along with what Mike said. So it's being able to kind of teach the standardized way first before you go into actually making changes based on clinical analysis, right?
Right.